guys, so today I am talking to Dr Naomi Potter, and we are going to talk all about menopause and body identical hormones. So welcome, Naomi.
Oh, thank you. Nice to meet you.
You too. So how have you been keeping up with COVID and all of the madness that is the world at the minute?
We've been really lucky because most of my patients I can see remotely, and so my little kids have been at school and my husband's at work, so we've had in comparison to other people, a really normal time. And we've had some kind of silver linings as well. We've spent much more time together as a family, and it's been and we've come out of it really, really well. We've been really lucky. How about you?
So I got made redundant from my events job, but it's actually enabled me to start in a women wellness and start what I've actually wanted to do for so long. So it's actually been a blessing in disguise for me, which is quite nice. So you touched briefly on your family. So I read you have 5 children.
Yes.
That is mental.
It's been interesting at times, but it's a lot easier now. The youngest are now 7, so for the first 4 or 5 years of their lives, it was just chaos, chaos, because I think I had 5, 6 under or something. I can't even think about it. But it's so much easier now. It's so much easier, and their little tribe, actually, it's really quite sweet.
What's the ratio of boys to girls, and what's the eldest?
They're 13 to 7, and they are 3 boys and 2 girls.
Oh, amazing! Oh, I love that. That's so cute. I'll take my hat to you though. That sounds hands full, and running a business as well. I mean, that takes a lot. So I guess how I wanted to start today is kind of if you could introduce yourself, give yourself an overview of your background, how you ended up to where you are, and just give people an oversight would be great.
So I'm a GP by training. I started off by doing obs and gynae. I've always been interested in women's health. I did that at St Mary's about 15 years ago, but I just found that I couldn't, my body just couldn't take the nights, and you do weeks of nights, and I just couldn't do it. So I thought that general practice was a really good way of carrying on with women's health, and also you're able to provide more of a holistic care if you're a GP, because you've got that continuity that you don't as a hospital doctor. So I went into general practice and specialised more and more in women's health, and then got interested in the menopause, and then that was kind of self-perpetuating. You go on a course, you meet more people, you end up doing more and more and more. And then by last year I had a menopause clinic at my practice, and I just felt like, I mean, they were great. They gave me some time to do it in, but I could never give enough. I might get a 20-minute session. Often I would only get a 10-minute session, and my clinic consultations now are 45 minutes, but they often overrun to an hour, and that's without waffle. It's just, that's how long it takes to do it justice. So I just thought, actually, why don't I give it a go? And I opened my private clinic in January. And it's been, and despite COVID, there's been some challenges, and so especially technical challenges, but it's worked really well. I've never been busier. So and that's where I am. So I'm doing remote clinics at the moment, and I hope I will probably go back to seeing patients face to face in September, but I will always carry on doing virtual clinics, because it means that I've now seen patients from all over the country that I would not have feasibly been able to see before. So
yeah, exactly. And that's a great thing about technology. It just can bring so many people together from everywhere. That's exactly what I'm finding out. But it's really interesting that you were at a GP, and you said like 10 minutes is not enough. I think in my life, I'm not at the stage of menopause, but I'm a sufferer of endometriosis, and my journey of getting a diagnosis and dealing with doctors was traumatic, to say the least. I got laughed out of the doctors because it was just being a woman, it was just being normal, and was not taken seriously for just so long. And I know so many other women that have gone through that as well. And so, for instance, my mum's going through it. She went to her GP, and it's a young girl who she sees, and she doesn't know. She's just not adequately trained in it. And I think what I'm hearing from a lot of women that are in my life who are in this phase of their life is they just said they just don't know where to begin. They feel they're not getting listened to at the doctors, and it's really putting them off listening to HRT and body identical hormones, and everyone's just kind of gone, oh no, I can't deal with that, like, because they've had such a experience being taken seriously. So what are your kind of thoughts on that?
I mean, it's just so sad, isn't it? I mean, that's it. Those are the patients that end up eventually finding me, and I mean, we talk about it. I don't know. I mean, you see, there's a kind of cohort of menopause warriors that spend all day and all night talking about it. It's not. I don't like GPs. It's not their fault they don't know about it. I did a whole obs and gynae career job and didn't go to a single menopause clinic. And in my GP training, I don't think I had any menopause training, and certainly we didn't learn about it at medical school. So unless you're kind of aware of it and you take it upon yourself as a doctor to really look into it, you could just be completely unaware. I've been on loads of update courses. Really, it's very rare that HRT is mentioned specifically, or the menopause is mentioned specifically. But the problem is that, you know, half the population is going to go through it, and there's a lot of old information out there, so everybody remembers the headlines from 10 years ago that were splashed all over the papers saying HRT is awful, and people haven't caught up. And so women are scared, doctors are scared, and it's not filtered through that HRT is safe and it has got enormous benefits, both in terms of symptom control and health benefits. So it's just getting that word out.
Yeah, I mean, I watched a video like ahead of our call about the difference between HRT, body identical and bioidentical hormones, and I was like mind blown, and I sent it to my mum who's going through it, and I was like, honestly, like this just gives you an overview of how different it is. And I think and exactly like the woman who was taking it, she said exactly the same thing as you. She said the information that is out there is based on so long ago, and it's got such a bad rep. And if people actually looked into the study of the big HRT one that was done, actually the ones that were 10 years out from menopause age, it actually had so many more benefits to them. So it is that education that I think women are now becoming a lot more aware that they've got to get a lot more educated about their health and kind of question things a bit more and read into it, because once you kind of figure out what you're struggling with on your HRT, it makes it a lot easier to have a conversation with your GP to say, like, could it be this? And then it enables the GP to increase their knowledge, and it's just that sharing and learning, I guess.
Yeah. It's very hard for patients though to navigate, because even on, you know, if you go on Instagram and you look at people who are purporting to be menopause experts, and the information is it's such a spectrum, and patients have to navigate to find the people that actually are using evidence-based medicine and following guidelines, and those that aren't. And how on earth can you know? How can you know?
Exactly.
As a patient, it's impossible.
Exactly. And I think that's part of the reason why I wanted to create this website, where it deals with all women's conditions, main conditions that women can suffer from, but have informative information on it. So it's not just people's opinions and stuff, it's evidence-based, and so people have a lot more. It's just in one website, can just access it all. Because I found, like, especially when I was researching endometriosis, I was going through millions of websites in a day just to find something that was actually with a shred of evidence, which obviously are trying to take that out from women. But it would be really great if you could kind of give the breakdown of HRT and where body identical hormones come into it versus these bioidentical hormones that have had a lot of, I think they've got a very good marketing team behind them. And I think that's kind of put them on people's radar a bit more. But yeah, it would be great to have that that overview from you of the differences and what
between the body and the bio. So body identical hormones, they're the hormones that I prescribe and what the British Menopause Society recommend. They are essentially, it's you give estrogen because menopause is an estrogen deficient state, and the hormone that we want to replace is estrogen. Now, in women who have a uterus, it is important to give progesterone as well, because one of the effects of estrogen is it causes the lining of the womb to grow. And if you allow the lining of the womb to grow unopposed, so continuously, then there is a risk that further down the track it can cause problems and develop into endometrial cancer. If you give progesterone, it puts water on that fire, so it keeps the lining of the womb in check. And so anybody that's been given estrogen needs progesterone if they've got a uterus. And there is no other purpose for that progesterone. So if you've had a hysterectomy, brilliant, all you need is estrogen. But if you haven't, then you need the progesterone as well. And the hormones that are used are estradiol, which is the same estrogen that your body produces, and a micronized progesterone, which is the same progesterone that's naturally occurring in women's bodies. And those two hormones together have the best side effect profile and the least risk when the estrogen is taken through the skin. So in the olden days, estrogen was given as an oral tablet, and that can increase the risk of clots. Whereas if you take estrogen through the skin, there's no increased risk of clots. Bioidentical hormones arose in the US, and it probably kind of came about after I don't know exactly when they were born, but it wouldn't surprise me if it was after the bad press that HRT got. And it's been a big movement. It's celebrity endorsed. It's amazing marketing, and they do use estradiol and progesterone. They do use those in various preparations. But the problem is, in the UK, the labs that make them, they say they're tailored to the person. So they do lots of blood tests to see what your profile is, but they are made in unregulated labs, and the concern that the British Menopause Society have about them is that they are unregulated. There's concerns about purity, and there's concerns about whether what is actually in the tube is the same as what is labelled, because they're unregulated, and the British Menopause Society do not recommend their use. And with body identical hormones, there isn't any need to dabble, to take that risk, because we prescribe exactly the same natural hormones that are derived from yams. But this way it's regulated, you know what you're getting, you know it's pure, and you can titrate according to symptoms and levels just as easily, but safely.
And I think that's the thing. It's just the awareness, and I have read a couple of things recently actually coming out about bioidentical that they're actually not safe, and there's more stuff coming out of the woodwork from them. So it'll be interesting to see that change. But that's what's tough about it, I guess. I think with women, if they start taking the body identical and they're still struggling, so say like they're still constantly bleeding, what would that be in your opinion? If you have someone who's really suffering from the menopause, they're still bleeding, they still have their womb, they're still getting periods and stuff, what would you say, what would your advice be if they're still struggling on HRT to find that balance?
So you can start HRT when you are still having periods, and actually it's a good idea too, start at that point rather than waiting till you're postmenopausal. If you are having regular bleeds, then that's normal. If you're having breakthrough bleeding, annoying bleeding, and you've just started on HRT, it can take a good few months to settle down.
Mm-hmm.
If it persists beyond that, then there's different progesterones that you can use. You can consider the Mirena coil. There are things that you can do, and also you have to make a decision as to whether investigation is warranted. But those are all kind of very patient specific. But it's not this is a disaster, this isn't going to work, let's stop, by any means. There's lots of, bleeding when you first start on HRT is a common side effect.
So it's kind of just persevering and seeing. And then if like someone tries the patch and it's not working for them, would you then say, okay, we can try the gel that absorbs in? Is that like what's the process if you start someone off? What's kind of the process, I guess?
It depends. I mean, the problem with patches is the availability, which is so hit and miss. But the hormone in the patch and the gel is the same. And some women absorb it differently from the patch and some women absorb it differently from the gel. But you can do blood tests to monitor absorption, and you correlate that with how the patient is feeling. So if the patient's symptoms have gone, but they've got other symptoms like bleeding, then you would target that. But if their symptoms haven't gone, you would look to see whether you're replacing the hormone to a sufficient level.
Okay. And so you mentioned about the shortages. So why is there a shortage of HRT? Like what's going on?
No one really knows whether it's a combination of manufacturing, Brexit, stockpiling, an increasing number of women who are going on HRT. No one. I've looked and there's no answers. I don't know. We don't know. Probably a combination of all of those factors. But people have been campaigning. It's been since October 2018, and there's some amazing campaigners who are really persistent. But of course, COVID has just totally,
taken over.
It's taken a real backseat. There was talk about 6 weeks ago of one of the products becoming more freely available, but I don't know if it's filtered through yet. It's such a shame, but patients are missing out. They're not having their hormones. They're having to switch and change, and that's causing disruption. It's not on. It's not on.
Especially the fact that like now women are living longer as well. It's such a long time for women to have to deal with this, and obviously menopause can last for so long. I'm not looking forward to that stage of my life.
You'll be fine. You take HRT, you'll be fine.
But it's trying to find that balance. I think just seems, from the people I have in my life is going through it, it just seems like quite a process to get it balanced, because the body is just, I mean, the body blows my mind anyway, but it's trying to work through it. And I guess like with the shortages, it just doesn't help if you're chopping and changing all the time. Like my mum, she's been put on different GPs on different types, and her body doesn't know if it's coming or going. So every time she's like having a stress about it, I'm like, you just got to give it some time and just see. And what would you say, like time wise, would you say on average give it 6 months and see? Or
I would normally say give it 3 months. Give it 3 months and then we will have another chat. And it's normally pretty clear as to whether, even if it hasn't settled, whether it's settling. And if it is, then you would give it a little bit longer. And if there was no sign of whatever the issue was settling, then you would think about making a change. But certainly, I mean, I have patients sometimes saying after a month, or I'm bleeding, or I don't feel any better. But you do have to persevere. And 3 months is quite a nice yardstick.
Yeah. Okay. And so Body Identical, you said it's made from said it's made from yams, and some are made from soya as well, I believe.
I think so, yeah.
If people have allergies to these, is it just the origin of it, so it's not going to affect you? Or if someone has allergies to them, how can they get around that? What's the alternative?
That is a difficult one, and it would be a patient by patient assessment, really. If you had an anaphylactic reaction to one of the ingredients, a lot of them contain peanut oil as well, the topical ones, then it would be, you would discuss it with the patient and whether you might do a patch test. Because they're topical preparations. So what you could do is just a tiny patch test and just see what your reaction would be. Likewise, if you thought you might be allergic to something within the progesterone tablet, it would be to do a risk assessment on the patient, and then you could do a trial with a much smaller dose and see what happened. But definitely a patient by patient approach for that.
And so some women have said that they've been prescribed antidepressants by their GP, for like their moods and everything like that. Does it tend to be a solution for antidepressants, or is it more looking at the progesterone, estrogen balance and seeing if like you can up the dosage of HRT? Is that more of a solution than antidepressants?
So the psychological manifestations of the menopause are due to a lack of estrogen. And the simplest way of turning those symptoms around is by replacing that estrogen. Now, some women can't or won't take estrogen, and in those women, then you would consider, depending on it depends on their symptoms, but for those symptoms, you could use an antidepressant, but it is not a first-line therapy. It is either I've tried something and it's not worked repeatedly, or it's because it's in a patient that can't take hormones. So if a patient who is amenable to HRT, has no contraindication to HRT, goes to their GP and they're offered antidepressants first line, that's not the right management of menopause.
Okay, perfect. So
does that make sense?
Yeah, it's just for women to know that, really, and to question it, because I guess it's when they have a bit more knowledge about these things of what they should ask and kind of see that what is the first steps, and they can kind of assess, oh well, actually that wouldn't be the line to go down. So that's really good, thank you. So I was speaking to the hormone fairy yesterday. She deals with menopause in a holistic way. She actually mentioned menopause is coming into the curriculum in schools. Like, this is amazing news, because I just feel like the education out there on periods, on women's health, is just appalling. I'm actually shocked at the education that's out there. I know in school I'm reading books about women's health and the hormone system and everything. I can promise you now, I did not learn it at school, and I'm shocked. So what would you kind of suggest? And I mentioned yesterday, I feel that it should be taught to children and partners of people, so they have a bit more understanding and they can understand it and have a bit more sympathy. But what would you like to see the curriculum kind of bring to the table?
The menopause is something that half the population are going to go through, and it's just not talked about at all. So the thing is, I come from a household where I've got a copy of my menopausal vagina on the coffee table in the lounge. So I think I have a bit of a skewed view of it, but it's amazing. I mean, it's just beyond any sort of rational thinking that it's not touched upon in education, because once children leave, you've got no control over how they're educated anymore. And yeah, I mean, Diane Danzer, do you follow Diane Danzer-Brink?
No, I will though.
Oh, she's brilliant. She is a lady who is spreading the word about making menopause matter. She had a horrendous time after she had a surgical menopause, was offered zero help, and got to the point that she was suicidal, and then managed to get her hormones. And she speaks at a lot of conferences, and she's got together this petition to make menopause matter. And I think she's responsible really for the change in that education and for menopause to be taught at school. I think that's her. might be worth double checking that it was her, but I'm pretty, and she's very vocal and in a brilliant way, and she just wants to spread the awareness so that nobody goes through what she went through.
Yeah, exactly. And I think that's the important thing. Like, the more women share their stories and their knowledge and what they've gone through, the more it empowers other women to take control of their health and learn. And the more women that come together to actually get that knowledge, the stronger the whole movement and voice becomes. I think that's the thing. Like, women just need to take the time, do the research, and kind of learn from reliable sources, definitely, and own their health and their knowledge, really, because that's where the power will come, and hopefully we start to see that change. Because obviously, like, what is your thoughts on how it is represented in women's healthcare, like in general, like on a top level?
Menopause care,
just women's healthcare as a whole. Like, what's your thoughts on how it's
I mean, menopause care is atrocious. If you think about how easy it is in the NHS to get a patient referred to a menopause clinic, in where we are, I mean, it was, and before I started seeing patients on the NHS, it was impossible. I mean, you have to wait 6 months, and 6 months for these women is, these women commit suicide. They really do. But I mean, other women's health care, certainly where we are on the NHS, is pretty good, but menopause care is not. It really isn't, and unfortunately, it's going to be another victim of COVID, because it will not be a high priority, and other things will take precedent. But what can we do? It's all we can do is just carry on.
It's just that's the thing that women, I feel, are just told to just carry on and just deal with it. And it's like a conversation I had last night. She's had patients that have come to her and have said, like, I'm on performance review at my job, I've done it for years, and this has affected me so much, and it affects women's life on such a grand scale, and for the support and sympathy not to be there, it's just, and we're just expected to just carry on as women. It's tough. It's really, would really like to see things change. Do you ever think that we'll get to a place where there's HRT available all the time, there's this amazing treatment that comes out that is just like makes menopause a breeze? Like, what do you see the future of menopause care being?
I think that huge headway has actually been made, even just in the last year. Social media, for all its kind of pros and cons, has been so helpful in spreading the word. I mean, I don't know what proportion of women we reach through places like Instagram. I'm rubbish with Facebook. I can't do it. But I think people are working there as well. And I think, in 10 years' time, we may look back at this period and just think, oh my God, I cannot believe how bad it was. Because the word it is spreading. The word is spreading. I think back to when I started on Instagram 6 months ago, and the number of engaged women is definitely rapidly increasing, and women are, I mean, I get messages all the time. Thank you so much. Been to my GP. I've got what I've needed. I've tried for 3 years, didn't get anywhere, and now I have. And I did a post yesterday, I think, or the day before, on what to say when you go to your GP. Like, this is what you want. And so, and I'm not the only person doing that. Other doctors are doing that, and even non-medics. The kind of menopause advocates or HRT advocates who are non-medics are still providing that information to women, and they're using it and they're getting what they need, but it's just for the women to know that we're here in the first place.
Yeah, massively. And it's also like to speak up about it and not be ashamed of it. I feel that, like, women's health, and you get your period and you kind of shuffle the tampon up your sleeve and you shuffle away, and it's lifting that shame that we kind of have, and the embarrassment of our health, when actually it's as you say, half the population goes through it. So it's kind of owning it a bit more and teaching yourself and reading and kind of getting the knowledge. So it helps the GPs, it helps you get what you need, and it's that whole cycle, I guess. So hopefully it comes around.
I hope so. We're trying. Yeah.
And then so where would you suggest, if women wanted to start learning and reading, obviously follow you for sure, but where would you suggest is a good place for them to start investigating and further reading about menopause?
The British Menopause Society has got a really brilliant arm called the Women's, what's it called? Women's WHI, Women's Health Initiative. And they have loads of patient information that, so meaty information, but explained really nicely for patients. So that's a really good source of evidence-based medicine for menopause information. I've got some links on my website to various other websites where people can find information about premature menopause, early menopause, PMS. So it is out there. There is a there is a hub of menopause kind of chatters and supporters on Instagram, and there are some on Facebook as well. I know there are, but I haven't managed to work it out. That's because I'm old. Anyone? Yeah.
And another question I've got for you. So obviously, you work through HRT and body identical hormones with your clients. Do you ever say about like food and exercise and nutrition? Does it goes hand in hand, I guess?
This definitely goes hand in hand. I work really closely with a dietitian called Nigel Denby, who I did an IGTV. Do you follow him?
I'm going to, yeah.
Yeah, he's brilliant. So he is a women's health dietitian, and you should give him a call. He'd love a chat with you. He has been in women's health for 20 years, and if you're putting rubbish in your body, you're going to feel rubbish. If you're not moving, if you're not exercising, no amount of HRT is going to make you feel well. So yes, HRT is brilliant, but it needs to be in combination with an active, healthy lifestyle where you do everything in moderation. Alcohol is a biggie, because the anxiety that goes with that kind of estrogen deficiency, women often self-medicate with alcohol because it dampens those feelings down, but then the rebound is worse, and then you end up in this vicious cycle where you're having to drink alcohol to quieten the feelings, and then the following day it's worse, so you need a little bit more, and it can be a vicious, it can be a downhill spiral.
And to say, like, women that kind of, they train a lot, they train hard, they weight train, they then hit menopause, it becomes a lot harder, doesn't it, for them to carry on at that level and keep pushing themselves. Do you find that you have women that kind of kind of grieve for how obviously their body changes, so what you can manage changes on such a big scale? And some women, do you have women that really struggle with that side of things, of having to kind of listen to their body more and step back a bit more?
I don't know if you have to step back if you are doing everything else. If you're doing everything else, if you're not optimally managed, say you are achy and tired and anxious, and then you've still got symptoms and you're not being optimally managed. If you can take HRT, then that would be how to manage it, and then there's no reason why you can't do what you did before. You can't halt aging, but you can definitely. So the menopause kind of ages you like that, whereas with HRT, you can go back onto the just the normal aging curve.
Amazing.
So women in their 70s are still running and doing Pilates and leading completely active. And I'm not saying HRT is essential for it, but it does help.
Amazing. Cool. I think that definitely gives some comfort to women who are worried about that, because I mean, I would worry about it. I'd be like, oh God, like this is it, but it doesn't have to be. And I think that kind of getting that message out there to women is you don't have to suffer. Just there are options out there.
There are, and there's a cohort of actresses who are coming through now who was were the kind of sex symbols when I was a teenager, and they're all they're all in their mid-50s, they're all hitting 50, or look at Jennifer Aniston, look at Kylie Minogue, look at Michelle Pfeiffer, they're all and they're still all hot, they're not middle-aged grannies, they're still womanly women.
Yeah, exactly. It's just changing that perception, I guess.
Yeah.
So to round it up, what would your top 3 tips be for women who are coming into menopause and are just so overwhelmed, have no idea where to begin? What would your top 3 tips be for them?
I would go to your GP and find out before you go who the women's health lead is in your practice. So you stand a good chance of seeing the person that is best equipped there to help you. And then
where can they access that?
Reception. So just when they phone to book their appointment, just ask the reception, who would be the women's health doctor here. Okay. And if they felt that they could, I would specifically mention menopause. Okay. And then you've given yourself the best chance to see the best person, and it's worth waiting. So I had patients who used to wait a couple of months to see me, but what you don't want is to go and see the person and get the wrong advice. So it's worth waiting. And then when you do go, you say, I think I'm going through the menopause. If you have symptoms and you are over the age of 45, you do not need bloods to confirm the menopause. If your doctor is concerned about other conditions, or you want a lifestyle check and a wellness check, absolutely have bloods, but normal bloods or no bloods should not prevent you from having HRT if that is what you want over the age of 45. Under the age of 45, you will probably you need to say to your doctor, I can be perimenopausal under the age of 45, and even if I've got periods, I can still be perimenopausal, and even if my bloods are normal, I can still be perimenopausal. Please take me seriously, and show them. They can go in with my Instagram page with the list of symptoms and a post that I did yesterday about what to ask your GP, and just say, look, I think this is me. What do you think? And if they flatly refuse, don't give up, go somewhere else. Most menopause, I do video consultations. They can, book and see me, and we can sort it out. But the most depressing is getting messages from people saying, I've struggled for 3 years and nobody's listening to me. I've struggled for 5 years and they all say I'm too young. If you feel it, then it's a valid, you have validity, and you should be able to get help.
Perfect. And then have you got two more tips that you would give?
Yes, don't take oral estrogen. If your GP tries to give you oral estrogen, then don't take it. Ask for transdermal estrogen. Cut down on alcohol, I suppose. Or is this what we're asking the GP specifically?
No.
Just general.
Like what tips you'd give to women to start if they're hitting.
Yeah. So, cut down as much as you can on alcohol, and try and exercise to the point that you feel breathless and sweaty, because that also helps with it helps with all sorts of things, but it helps particularly menopausal symptoms, and the menopausal symptoms of anxiety, which can be the most overwhelming. So it helps, and sleep. So it's brilliant. Basically, exercise is brilliant.
That's amazing. Well, thank you. That was so informative.
And helpful.
Thank you so much for your time. Like, it really means a lot. And where can people find you if they want more information?
So I'm on Instagram as Dr Menopause Care, and I've got a website. It's easy. It's drnaomipotter.com. and my contact details are all there, and I'm very happy to, I can't give kind of patient specific advice, but I'm very happy to send people, funnel people in the right direction, and yeah, do as much as I can.
Amazing. Well, it's amazing what you do. So thank you so much.
Pleasure. Lovely to speak to you. Good luck with it all.
Oh, thank you. And I'm going to post this on social, YouTube, podcast, the whole shebang. So
Thank you.
I'll keep you posted. But honestly, thank you so much.
Pleasure. Keep in touch.
I will do.
Well done. Thank you.
Take care.
Take care.
Bye.
Bye.